Hey there. I want to talk to you guys about something that happened to a patient of mine that in the outset seemed like a negative response to a supplement we were using, but when we dug in a little bit more, it unveiled like how powerful the supplement is at what it does. Okay. So the situation was it's a Parkinson's patient of mine, and she was finally taking her supplements on a regular basis. And she was starting to get some breakthrough events from her Parkinson medication. So you take Parkinson medications kind of on a regular frequency, and a breakthrough event is when your symptoms kind of come back strongly in between your dosing. All right, and that's a sign that you might need a stronger dose or something else is going on. So she was having a breakthrough on her morning dose. And so we were kind of digging in, talking about it, and I was asking about, like, oh, she's like mentioned that she just started taking her supplements and she thinks that maybe that was the reason that it was happening, and something that might be off. So I asked her about how that was going. And so she was telling me that she was taking her supplements with her morning dose of Parkinson's medication, which she was actually told not to do. She was told to take them at least a couple hours apart because of this, right? And so one of the things she was on was something I use quite a bit, which is the Humic and Fulvic formula here, which is really great at detoxifying your body and binding to toxins and pulling them out of your body. And because pharmaceuticals are toxins, they're pretty much all toxic and recognized as toxins from your body. Um, this is binding. It was binding to her medication and preventing it from having an effect on her body, which is why, and I was aware of that this would happen, and that's why I had given her instructions to take it at least a couple hours apart, because that would happen. So she was taking her medication and then taking the Humic and the Fulvic right at the same time, and it's just binding to the drug and passing it right through her system, so it was never having an effect on her. So that's good and bad, right? That's bad that it was working that way, because that's not what we want to do. We don't want to interfere with the drugs or the pharmaceuticals that the patients are taking. We want to assist them or make them obsolete. But it's good in the fact in demonstrating how powerful of a detoxifier this is. And so, this is a formula that both goes into the cells and pulls toxins out of the cells, but also detoxifies, in the interstitial fluids around the cells, detoxifies your digestive tract, detoxifies your blood, your lymph, and all those things, which, is very important for calming down rampant inflammation. So that's how powerful this is, and that's why I put people on this, but you have to take things appropriately. So that's also why it's good to dig into these things and never just assume something, because once you pull things apart, you may have a different perspective on the situation, and get a better understanding, and then make a better decision on how to respond to that. So that's my story on Humic and Fulvic, and I think it's a good story. It shows you how powerful of a detoxifier this is. We just have to use it appropriately. And all right, have a good frequency.